Vanakkam, Namaste and welcome to Ruchira's Clinic. In this video, I'm going to answer the question, how to test for erectile dysfunction. Now, an individual is said to have erectile dysfunction or erectile disorder if he's unable to sustain his erection or is unable to get an erection adequate enough for penetrative sexual intercourse. So, what are the tools and testing methodologies that we use to diagnose ED? I'm going to answer this video in two parts. So one, we are going to look at all the tests that you should do if you have erectile dysfunction. And we are also going to look at all the tests that you should not do if you have erectile dysfunction. So what are the tests that you should do if you have erectile dysfunction? Now, when you visit an andrologist or a sexologist near you for erectile dysfunction, the most important thing is a clinical psychosexual history. So a clinical psychosexual history or a psychosexual history will give ample information to the andrologist or sexologist about your overall lifestyle habits, your social habits, overall general health, sexual fantasies, interpersonal relationship with your partners. And it's a series of questions. We take the psychosexual history because we want to, kind of break down and, try to understand first, what kind of individual you are, with respect to your sexual health. So it's a series of questions. You have about 40 to 50 questions that your andrologist or sexologist will spend at least 15 to 20 minutes time with you asking you these questions, because the psychosexual history combined with, a general medical history itself can clinch a diagnosis of ED in almost 95% to 98% of the cases. It's not at all hard. So first step, psychosexual history. Second step is going to be, the test is going to be the general medical history to rule out diabetes, hypertension, cholesterol. Third, we will then give the patient something called as the IIEF questionnaire, which is called the International Index of Erectile Function Questionnaire. And with this questionnaire, we can usually diagnose ED very sensitively, and we categorize erectile dysfunction as either mild ED, moderate ED, or severe ED. And depending on what the diagnosis is, we try to treat the patients. So these are things we do to clinically assess and test for ED. And apart from that, what are the blood tests or scans, or, do you need fancy scans at all for the diagnosis of ED? So basically, when an individual comes to the clinic for ED, we take the history, psychosexual history, we take a medical history. 3, we do the IIEF questionnaire workup. We try to establish a provisional diagnosis of ED, whether it's mild, moderate, or severe. Number 5, then we try to find out the root cause of ED. So the history itself will give us, the clinical history will give us adequate information. Then we go in depth into the blood tests. So what are the blood tests we do to diagnose ED? Now, minimal testing is what is recommended as far as erectile dysfunction is concerned. It is very, very sad that today a lot of andrologists and sexologists are writing packages for ED that cost anywhere from 20,000 rupees all the way up to 30,000 rupees. That's not at all required. Now, let me tell you the list of blood tests that you should do for ED. Bare minimal testing. You should do your blood sugars, your HbA1c. You need to check your BP once, and you have to do your cholesterol profile. Complete blood count is usually optional. Only if you have infections, you do a CBC. Then you do what's called as the male sex hormone assessment. And in the male sex hormone assessment, what is actually required is basically only your total testosterone, your free testosterone, sex hormone binding globulin, and your prolactin, and maybe your estrogen. These are the 5 hormones. There are only about 5 to 6 hormones you have to do. Total tests are only about 8 to 9 for the diagnosis of erectile dysfunction. 98% to 99% of patients will have a problem in one of these parameters, or will have a problem in other psychogenic parameters. If it's not in the blood test, it will reflect psychologically. So basically, erectile dysfunction is graded into psychogenic and organic. We do the blood test to see if there's an organic cause. If there are no organic causes, it's probably psychogenic in nature. And the history that we took earlier before the blood test helps us to diagnose ED. Now, these are the tests that are only recommended from most of the prominent healthcare organizations recommends minimal testing for erectile dysfunction. But today what's happening is a lot of andrologists, well-qualified andrologists and sexologists write a battery of tests for ED. What are the tests that you should not do for erectile dysfunction? Let's look at that now. So some of the clinics, if you visit them, they will write you ultrasound scan of the scrotum. They will write you something called as the penile Doppler. They'll write you a transrectal ultrasound. They'll ask you to take an X-ray, chest X-ray, ECG, and all sorts of nonsense tests which are not at all indicated for ED. Now, let me tell you why. You don't need an ultrasound scan of the scrotum, because a physical examination itself will tell you whether your testis size is a normal portion or not. And the male sex hormones can tell you whether the testis is functioning or not, whether your hormone production is normal or not. So ultrasound scan of the testis is not required for patients who are suspected to have erectile dysfunction. Ultrasound is usually required only in patients who have, male infertility because of obstructive azoospermia. That's a story for another day. Right. The second scan that most doctors tend to write, and very sadly, is a test called as the penile Doppler. for erectile dysfunction. There's absolutely no indication for penile Doppler unless or until the patient has a condition called Peyronie's disease. Again, Peyronie's can be clinically evaluated by palpating the penis. If there are fibrous plaques in the shaft of the organ, we suspect Peyronie's, then we write penile Doppler, or we do a duplex, or we do a penile ultrasound. We don't even need the blood flow Doppler pattern. The joke is, doctors write penile Dopplers because they want to diagnose whether the patient has something called as a vasculogenic ED, or if there is a blood flow problem in the penis. Now, what's happening in most scan centers is, when you go for a penile Doppler, they will give you a tablet called sildenafil or tadalafil. And when you take the medicine, you have to take the tablet 45 minutes before the scan. And when you're doing the scan, you should have an erect penis. Your organ should be erect. The big bad joke is, in a scan setting, when you're going for a scan and when you have people around you, how on earth will you be able to achieve an erection? First of all, there's no privacy. Plus, you're going for testing. So what's happening is, most radiologists are taking scans on the flaccid penis and they're giving baseline values of the penile Doppler, which makes absolutely no clinical sense. If the penis is not erect, how can you even take a proper penile Doppler reading? How will you look at the flow pattern in the organ? How will you, first of all, make a diagnosis whether the patient has a blood flow abnormality? So a penile Doppler is not at all indicated. If your andrologist or sexologist writes a penile Doppler for you because you have erectile dysfunction, you can tear it and put it in the dustbin, or don't even take the test. You can tell the doctor you don't have money, no problem. So don't take a penile Doppler. Don't take ultrasound scan. No medical imaging is necessary for diagnosing erectile dysfunction, only in exceptional cases like Peyronie's disease, or if the patient has had, genital surgeries or, urogenital surgeries, only then we recommend imaging. It's very rarely indicated. In my 6 years of practice, I've recommended ultrasound imaging only for one patient who had Peyronie's disease. In the 4,000, 5,000 patients that I've treated, none of them required imaging. A physical examination is all that's required. So remember this in mind. And there are some doctors who write chest x-rays, ECGs for patients with erectile dysfunction. Now, if you're an older individual, right, say if you're above 45, you're above 50 years of age, and say you have a past cardiac history or you are at the risk of developing coronary artery disease or some other cardiac condition, then yes, doing a chest x-ray is important. Because then, if there's a problem in your chest, if there's a problem in your ECG or chest x-ray, if there are some findings there which shows pulmonary insufficiency or, you have some cardiac anomaly, then we have to carefully give you the dose of medications for ED has to be adjusted accordingly. But if you're a young individual, less than 35 years of age, you don't have any cardiac risk factors like, excessive waist-hip ratio or elevated BMI, or you don't have anything to suggest that, you are a risk candidate for cardiac problems. There's no indication for chest x-rays or ECGs prior to starting ED. Some doctors also prescribe what's called as the treadmill test for diagnosing, when diagnosing ED. The treadmill test is also not indicated for young patients. If you're an older individual, you can do a TMT to assess cardiac function, and then you can give PDE5 inhibitors and adjust the dose of the medication, the cardiac medication in consultation with your cardiologist. And that's safe. But for younger individuals, less than 35 years of age, treadmill test, ECG, X-ray, penile Dopplers, scans, these are not at all required. So I hope you found this video truly informative. You now have better knowledge than most people on what are the tests that are required to diagnose ED. Please share this video with all your friends and loved ones. Like, comment and subscribe. Please support this channel. I'm putting in a lot of effort to make this content. I'm not very good with all these videos, but I'm trying my best here. I'll be making a lot of videos for you, a lot of informative content. Please like, comment and subscribe, and I'll see you soon with another video. And this is Dr. Shah.